Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
Climate change and environmental concerns are reshaping dermatology, bringing about new challenges for clinicians. Rising global temperatures and the increased occurrence of natural disasters result in geographic spread, atypical clinical presentations, treatment delays, antifungal resistance, and systemic complications of fungal pathogens such as Trichophyton indotineae. However, dermatologic care also contributes to the environmental footprint through topicals, procedures, and biologic therapies, with additional impact from patient travel and waste, mirroring trends across healthcare. Addressing environmental accountability is no longer optional. It is integral to the future of high-quality, ethical dermatologic practice. Stay tuned for more from the August issue of the journal.
This month's review segment opens with an open access narrative review by Trichophyton et al., highlighting body dysmorphic disorder. The condition, now recognized as an obsessive-compulsive and related disorder, combines ideas of beauty and glamour with inordinate widespread concern, mainly affecting young people and those seeking to remain youthful. The authors update concepts of this disorder in an era with multiple social media platforms, providing a setting for communication and information sharing.
The related commentary by Slavic and Osvath places the review in a wider context. The authors discuss the historical roots of the condition, dating back to Freud, and its evolution in psychiatric classification, now recognized within the obsessive-compulsive spectrum. They mention that BDD frequently coexists with anxiety, depression, substance abuse, and personality disorders like borderline and narcissistic personality disorder, and it also carries a high risk of suicide. The article emphasizes the critical role of dermatologists in recognizing BDD, as poor communication and unnecessary aesthetic treatments can worsen the condition.
Next, Gupta et al. Delve into fungal infections, an important source of morbidity and mortality that can manifest as superficial or invasive diseases. Diagnostic techniques for human fungal pathogens remain problematic, and multi-drug resistance is emerging. This review addresses the potential emergence of new fungal pathogens in changing environments and reported instances of cutaneous fungal infections after natural disasters. Global warming does more than increase the mean global temperature. It is associated with changing precipitation patterns and major climatic events. With natural disasters, niches are created for the proliferation of fungal pathogens affecting humans across previously existing geographical boundaries. Here, we reviewed reports of cutaneous fungal infections after natural disasters, including earthquakes, floods, tsunamis, hurricanes, and tornadoes. Of importance is the potential for thermal adaptation leading to the evolution of new human pathogens, exacerbated by the elevated environmental fungal levels in disaster situations. Studies have documented higher risks of contracting typical tinea infections, as well as opportunistic trauma-related infections by environmental fungi. The latter is especially concerning due to atypical clinical presentations that could lead to treatment delays, antifungal resistance, and systemic complications. These support the importance of considering climate change as affecting the adaptation of these pathogens and the consequences of this change for human populations. A One Health framework should be advocated to address the impact of climate change on dermatological care. Cool.
Moving on to another common hazard, Scott et al. Reviewed the latest information on nail product safety. Increasing research in this area has shown that some ingredients in nail products are hazardous and can lead to both dermatologic and systemic diseases. This risk is present for nail product consumers and is increased for nail technicians. Another concern with the nail products being used is the mislabeling of ingredients. The paper aims to assess the current literature on nail product safety, promote consumer safety, and encourage the involvement of dermatologists in promoting safe nail product use.
In their review, Niebel et al. Take a novel approach to the dual interplay between the environment and healthcare, which is associated with around 6% of global greenhouse gas or GHG emissions, high water consumption, and large volumes of waste. Dermatology encompasses peculiarities such as the extensive use of topicals and cosmeceuticals, specific procedural treatments, and a wide range of activities spanning from dermatopathology to the use of biologicals. Some of these aspects might bear a significant environmental footprint, which has been characterized insufficiently until this point. According to recent data, The greatest share of overall greenhouse gas emissions associated with outpatient dermatology is purchased goods and services, followed by patient travel and waste, paralleling the health sector overall. To address these topics, 6 working groups on climate change or sustainability exist within the following dermatology associations: the American Academy of Dermatology, the Australasian College of Dermatologists, the British Association of Dermatologists, the European Academy of Dermatology and Venerology, the German Society of Dermatology, and the International Society of Dermatology. Member activities include scientific projects such as original research and review articles or symposia at national conferences, provision of educational materials for trainees and peers, and advocacy. Dermatologists should be familiar with the environmental and climate impact of daily practice and use available resources for more information. At this time, a significant gap exists between individual sustainability efforts and the integration of these practices into policy. The authors propose to strengthen international collaborations within the field to provide more sustainable dermatological care.
August's original articles include a contribution by Guldikin Dorwell et al. The authors focus on self-induced nail disorders, or SINDs, which are a subset of body-focused repetitive behaviors, or BFRBS, characterized by pathological grooming habits that damage the nail and periungual structures. These disorders were classified into subgroups based on the specific methods individuals use to harm their nails. Despite their prevalence and potential psychological impact, limited data exist. The study aims to investigate the demographic and clinical characteristics of SINDs. This multi-center prospective cohort study included 675 patients diagnosed with SINDs at dermatology outpatient clinics between February and June 2024. Data collected included demographic information, SIND subtypes, associated BFRBs, psychiatric history, and family history of BFRBs. Patients were categorized into 6 SIND subgroups. The mean age of SIND onset was 16.60 plus or minus 10.61 years, with no significant gender difference. 47% of patients belonged to more than one SIND subgroup, and 45.4% had other BFRBs, with cheek, lip biting, and acne excoriae being the most common. Females exhibited higher rates of accompanying BFRBS. Patients rarely sought medical treatment, even if they felt severe discomfort regarding their habit. Patients with diagnosed psychiatric disorders or a family history of BFRBS were more likely to seek treatment. The authors deem that dermatologists play a vital role in identifying SINDs, addressing associated behaviors, and coordinating care for coexisting psychiatric conditions.
Further in this month's original research publications, Lee et al. Investigated atypical fibroxanthoma, AFEX, and pleomorphic dermal sarcoma, PDS, which represent clinicopathological variants of a spectrum. It is known that AFX and PDS tumors harbor frequent NOTCH1-2 mutations. However, the expression of Notch signaling pathway-associated proteins in both tumor cells has not been studied before. The authors conducted an immunohistochemical study by performing Notch1, Notch2, NOCD, and HS1 staining on the most representative formalin-fixed, paraffin-embedded tumor tissues out of 62 patients with the first diagnosis of either AFX or PDS in a single tertiary medical center. 10 patients had disease progression in terms of loco-regional relapse, including local recurrence and regional lymph node metastasis, with a median time to first recurrence interval of 8 months after a wide local excision. Among all the Notch expression profiles, only the upregulated Notch2 expression has a positive correlation with disease progression. Furthermore, it was found that HS1 is activated through the Notch2 signaling pathway rather than Notch1, and Notch1 does not appear to be functionally active. Upregulated Notch2 expression plays a significant role in disease progression, in part through the canonical signaling pathway involving the downstream effector HES1. As a result, targeting Notch2 signaling might hold therapeutic promise in patients with disease progression.
Chateau et al. Contributed with a study on epidermolysis bullosa, or EB, a rare heterogeneous genodermatosis characterized by skin fragility due to inherited defects in genes encoding proteins that maintain epidermal dermal integrity. The severity and complications of EB vary by subtype, and no cure currently exists. The epidemiology is currently unknown in South Africa. This prospective observational study in KwaZulu-Natal correlated African Zulu EB patients' phenotypic features with genotypic and histological findings. Whole exome sequencing, electron microscopy, and immunofluorescence mapping were used to identify EB subtypes. 14 of the 15 patients recruited initially were confirmed to have EB, while one was excluded due to poor clinicopathological genetic correlation. Junctional EB was identified in 11 patients, with 10 cases linked to a recurrent homozygous pathogenic variant in LAM3 causing severe GE, and one to IJD with an unusual variant of interstitial lung disease, nephrotic syndrome, and EB. 2 patients had autosomal dominant EB simplex, both with heterozygous KRT14 variants, and one had dominant dystrophic EB associated with a heterozygous COL7A1 variant. 11 patients presented during the neonatal period with a mean survival of 4 weeks, highlighting a high mortality rate, especially in the severe JEB cases. The cohort exhibited a balanced sex distribution, with no clear cases of consanguinity observed. JEB, with a recurrent pathogenic variant in LAM3, emerged as the predominant subtype among African Zulu patients, underscoring the critical need for early diagnosis and tailored management strategies in resource-limited settings. The authors conclude that integrating clinicopathological and genetic data is essential for accurate diagnosis and prognosis, emphasizing the importance of advanced diagnostic tools in improving outcomes for EB patients in South Africa.
The last original article published this month centers on keloid treatment. Keloid treatment remains challenging due to high recurrence rates, particularly in patients with higher phototypes. This study by Brando et al. Aimed to assess the resolution, patient satisfaction, and recurrence rates in 79 keloids treated with a sequential non-surgical protocol, combining long-term occlusion with hydrocolloid dressings, monthly injections of triamcinolone and 5-fluorouracil, and intense pulse light therapy. This approach is expected to lower recurrence, improve resolution, and increase patient satisfaction compared to traditional treatments. The longitudinal observational study included 79 keloids in 55 patients with Fitzpatrick phototypes 3 or higher. Data were collected retrospectively from medical records and clinical appointments. Patients were followed for 19 to 123 months after completing treatment. Outcomes evaluated included keloid resolution, patient satisfaction, and recurrence rates. The patients had a mean age of 39 years and underwent treatment for a median of 10 months. Pain was reported in 8.9% of cases, and only one recurrence occurred 5 years post-treatment. Complete resolution was achieved in 82.3% of keloids, and 94.9% of patients reported maximum satisfaction. The sequential non-surgical approach evaluated in this study demonstrated low recurrence and high satisfaction rates. Thus, it may represent a promising treatment option for keloid patients with higher phototypes.
Among our shorter publications, an open access letter to the editor by Paraga et al. Evaluated the effectiveness of portable facial artificial intelligence, AI, technology in monitoring changes in atopic dermatitis, AD, on the face following treatment. 10 patients with varying skin types were assessed using both a portable AI device and a traditional computer-based system, with a focus on facial redness and under-eye features. The portable AI showed a statistically significant improvement in facial redness scores and had a strong correlation with the computer-based device and physician assessments. While promising for clinical use in patient self-monitoring, limitations such as the small sample size and lack of skin type stratification may affect the generalizability of the results.
Another letter by DeWood et al. Investigated whether stool blood and fecal calprotectin tests could predict Crohn's disease in patients with idiopathic pyoderma gangrenosum, PEG, a skin condition often linked to inflammatory bowel disease, IBD. Among 21 idiopathic PG patients, 4 developed Crohn's disease, typically within 3 months of PG diagnosis. Stool blood showed 82.35% specificity, a positive predictive value of 57.14%, and a negative predictive value of 100%. Calprotectin had 50% sensitivity, 100% specificity, a positive predictive value of 100%, and a negative predictive value of 89.47%, making both useful non-invasive screening tools. The findings support early gastrointestinal evaluation in idiopathic PG patients with positive biomarkers to enable timely diagnosis and management of Crohn's disease.
This was the August episode of IJD in Focus. Thank you for listening. Until next time.